Okay. It would be fine.
Yeah. So, as I was saying, the sun's come out after several days. So it's really nice to see all of you having made an effort to come today. This talk, while it focuses on women's health, I've specifically focused on perimenopause and menopause because I figured that the group of women that are here are generally over the age of 30. Would I be okay to say that? Because anybody above the age of 30 really should be learning about this and under this age as well. And the men in the audience, everything that I say today actually applies to all of us, whatever our gender, when it comes to lifestyle medicine. There'll be aspects that are useful for you because almost all of us have women in our lives, whether it is, as Rakeshji said, mothers, sisters, daughters, friends. So I think you will find this information useful, but all the lifestyle medicine information that I give applies just as much to men, to children, to however you may identify, just as it does for women. So a little bit about myself before I start. I trained in India as a doctor, and this was many, many, many years ago, and decided that after doing my post-graduation in OBGYN in Delhi, we moved to the UK. And even there, I finished all my training, but I always felt something was missing from my toolbox. And I didn't know what it was because I was delivering all these women, complex deliveries. I was operating on women with large fibroids, heavy bleeding, cancer. I was doing keyhole surgery, robotic surgery, but I felt something was missing. And I just couldn't figure out what it was until I discovered lifestyle medicine. And I realized that while it is so, so important for us not to negate the huge impact that Western medicine has had with the help of vaccines, with the help of surgery, with the help of medications, we cannot disregard how important lifestyle is because the vast majority, as Natalia said, that the primary care physician and even doctors like myself in hospital medicine see are actually chronic health conditions. And there is no aspect of women's health that does not benefit from lifestyle medicine. Not a single condition that you can think about, whether it is pregnancy, whether it is postpartum, whether it is puberty, menopause, perimenopause, same thing for men, whether there's any chronic health condition, whether it is cancer or heart disease or high blood pressure, we know that bringing in lifestyle changes with or without medication, depending upon how severe it is really key. And this is why I spend a lot of time talking to doctors, trainees, medical students, nurses, because sadly, I must have got a total of 2 hours of lifestyle or nutrition training in my entire career. And this is true for most doctors. Now it's getting a bit better in some New York medical schools and all over the world because younger doctors are asking these questions. They don't want to just be prescribing medications without looking at the whole picture. But the nutrition that I was taught was, what is a calorie? How many calories are there in a gram of fat or in a gram of protein? That was biochemistry that we were taught. We were not really taught how lifestyle or nutrition specifically impacts our health. And I think that that is something that is really missing in our education, and the public are just as important. You, the public, need to take matters in your own hands as well and question your doctors as well as question your own lifestyles when you read confusing things. And it's not anybody's fault. The problem is there is a whole lot of factors that are stacked against the ordinary person, pushing them into chronic health conditions because of the foods that are subsidized, the way we live our lives. We are not as mobile. We come in a car. We have lots of things that help us with our housework. So overall, we find that there are so many changes that we can bring ourselves, and that is what lifestyle medicine is about. So I'm going to start talking a little bit about that. I have been a consultant in London for several decades, and I was on the wonderful NHS, which I think USA is trying to emulate. But the National Health Service in the UK is one of the most wonderful establishments where treatment is free at the point of care. It doesn't matter whether you're a king or whether you're a pauper, you will get that care, and you will get it, you know, especially when it is an emergency or cancer treatment, you get it immediately. And if it is something that is not that urgent, you do have to end up waiting a little bit, but allows you to actually get all the treatment that you need right up to date and evidence-based. So I was very privileged to work in that for several decades, and I now still work, but now left the NHS and I'm doing some private work, but spending more time educating. So today's talk will be focused on perimenopause and menopause, but with a deeper dive into lifestyle medicine. But before I start, I want everybody in the audience to understand that nobody really knows your body better than you. Not your mother, not your doctor. So when you ask your doctor, what should I do? The doctor is actually advising you based on their experience. Rather, the question you have to ask your doctor is, doctor, what would you do if you were in my situation? Rather than asking them what they advise for you, because, you know, that's a completely different answer. But nobody really knows your body better than you. And this is important because when we did a survey of educated women, 2,000 women were surveyed in London, and 1 in 2 did not know where their cervix was. They did not know where their vagina was. In fact, 1 in 10 women did not know where their reproductive organs were. So, it's okay. No, I'm fine. I'm fine. Yeah. So this is important. Why? Because this is basically looking at the outside of your vagina and vulva. Now, if you don't know the different parts of your organs, what happens is you go to the doctor and you say you have an itch. You have an itch down below. Now, what is the doctor going to think? The doctor is not going to know whether you're talking about the vagina, which is the tube that runs from the outside to the inside towards your uterus, or are you talking about the vulval area? So there was a, oh, sorry, Rakesh, did you take the clicker? The clicker? Ah, sorry.
No problem.
I don't know if there's a, is there a mark?
Yeah, there's a marker in the front.
Oh, what happened here?
Yeah, I'll show you.
Yeah.
See this green.
Yeah. So it's important to know the different parts of the body, where the clitoris is, which is the male equivalent of the penis, the little opening where one passes urine, the lips of the vulva. So if you have an itching over here, that could be a skin condition, it could be eczema, it could be lichen sclerosis, it could be cancer. While if you have an itch coming from the vagina, which is the tube leading up to the uterus, that could be a whole other things. It could be an infection, it could be thrush, it could be an STI. So it's so important that you know the different parts of your body when you explain to the doctor what exactly is happening to you. Because if we don't know these different parts of our body, you're going to end up getting the wrong medication because the doctor doesn't have the time. They have 10 minutes for you and they'll assume that you've got a vaginal infection just because that's more common, and will miss a condition that is an autoimmune condition like eczema or lichen sclerosis, which the treatment is completely different. So I really would say to everybody, spend time to understand what your body is about. So this is the uterus, this is the vagina. And so this body of the uterus has 3 layers. It has the outer layer, which is called the serosa, the muscle layer, which is called the myometrium, and this lining sheds every month, and that is a period. When a pregnancy does not happen every month, that lining sheds, and that is how you see the blood coming out. Now, this is where when you get pregnant, this is where the baby sits usually. These are 2 ovaries. You're born with the number of eggs, and in menopause, when these number of eggs drop to a certain critical level, when they stop, that is when your period stops. So everybody is born with 2 ovaries. Sometimes you may be born with 1. You can live your whole life with just 1 ovary, but ideally you want to have both of them. You have the fallopian tubes. So usually what happens to, so a sperm will come up the vagina, go up to the uterus, go through the fallopian tube, and an egg is released once a month. And at the critical time, they meet inside the fallopian tube, they get fertilized, and then the embryo implants itself and 9 months later a baby is born. And a lot of times these things can go wrong. So you can have a miscarriage, or you can have an ectopic pregnancy when it's in the tube. But it's so important, again, to know the different parts of the body. The cervix, where you have a pap smear. I know in the US you have it every year. In the UK, we do it once in 3 years until the age of 50, and after 50 till 65, we do it once in 5 years. This is to pick up infections that cause cervical cancer. A virus causes cervical cancer, and so that is always a surprise for people. But it's important to know that it's a sexually transmitted virus, human papilloma virus, and that's what the smear test or the pap smear is trying to take. So it's important to know how the whole body works, as well as the location inside your own body. So really spend some time understanding this, because, as I said, educated women, they did not know, 1 in 2 did not know where their cervix was. So this is the menstrual cycle. Again, just important for you to know that every month an egg is released, then the lining gets thickened, and once the lining is thickened, usually about 28 days into the cycle, the lining sheds because there's no pregnancy, and a menstrual period occurs. Once again, another egg starts getting mature. As the egg gets mature, the lining gets thickened, then the egg gets released, the lining thickens even more, and then the whole cycle repeats every 28 days. So it's a very important sign. If somebody is not having their period, it could be for a number of reasons. So it's one of the important questions a doctor has to ask when a woman comes to the hospital, to the ER or to the clinic, because it may indicate that you have an eating disorder if your periods have stopped, or you may be exercising too much, or you may be in early menopause. So those things are important, because if you have a fracture and you have an eating disorder, that might be because you have very low levels of estrogen. So every department should ask a woman when their last period was, do they have regular periods? Because if you're pregnant and you have surgery, that can be an issue as well. So we always do a urine pregnancy test when a woman attends the hospital. We use this word a lot, hormones. What are they? They're basically chemical messengers, okay? And so it's important to understand that these chemical messengers are they're like little magicians. Basically, they are produced often in the brain, but they work in organs which are far away from your body. So the thyroid hormone is produced from your brain, thyroxine stimulating hormone, and it works on your thyroid, which is in your neck. Same thing, you will have hormones like FSH and LH, which are produced by the pituitary gland, which is a small, tiny pea-sized gland at the base of your brain. And that will then cause further release of hormones from the ovaries. So you have hormones produced by all these different glands, from the pancreas, from the adrenal glands, cortisol, from the ovaries, from the pancreas, from the thyroid, from the thymus. So these are chemical messengers that are produced in one organ, often the brain, and they work their action on a different distant organ. So it's important to know what hormones actually are. Okay, so we are now going to talk a little bit about what menopause and perimenopause is. So this statistics is really important. Normally, I don't like to put a lot of statistics and a lot of scientific stuff, but a quarter of the world's population will be menopausal by 2030, and we're in 2025. That is 1.2 billion women, okay? That's a huge number of women, and of those women, 8 out of 10 people who are in menopause are actually at work. And this is not even taking into those who are looking after they are the main carers. You know that most women tend to be the main carers for their parents. Yes? It's all very well to have a son, but boy, are you lucky if you have a daughter. Okay? And so it is important to understand that while you're going through menopausal symptoms of hot flashes and night sweats and body ache and fatigue, you're also having to go to work. You're also having to compete in big meetings, as well as look after parents, look after younger children. So it's really important to understand that we must make provisions, and there's a big drive in the UK to actually make provisions for people who are menopausal and perimenopause at work. Simple things. It could be like having a fan in the room, making sure that your desk is near a window, making sure that you have access to a toilet. So that these are things, because we know that when you are entering perimenopause and menopause, there can be issues with increased frequency while passing urine, or you may suddenly feel very hot, and so being near a window or having a fan near you can really make a difference. But we know that still there's a lot of work to be done, a lot of work, but we are making some progress. Of the women who suffer with menopausal symptoms, 1 in 4 are so severe that they often end up leaving their job. And that is a shame, because imagine, as a doctor, if I've had 3 decades of training and working, and now I hit 50, I'm 63 by the way, so it's okay, but if you hit 50, what happens is you then end up leaving your job because the support system is not there. So as women who are in powerful positions, as men who are in leadership positions, you need to listen to women when they come and tell you we are having issues, whether it's in pregnancy, whether it's with period problems, heavy periods, painful periods. Do not let anybody tell a woman that having pain during a period or having heavy bleeding with clots is normal. Just because you had it or your grandmother had it or society tells you it's normal. No. Period should not be painful. You can have mild cramps on the first day. Anything more than that should be investigated for things like endometriosis, for things like adenomyosis, fibroids. And so these problems can continue into perimenopause and into menopause. So if you are in positions where you have women working with you, women working for you, please try and bring some changes in so that women are heard. There are also a lot of social and cultural factors that affect menopause. So if you were in a village in India, or if you are in an African community, tribal community, stopping your periods is often welcomed. Why? Because suddenly you're able to sit at the same table as men and have discussions. You're considered to be wise. Okay? While in the West, we often look at menopause as something to be feared. We are worried about getting old. We are worried about having wrinkles. We are worried about just not being attractive enough by being passed over, whether it is on television or whether it is in the media or whether it is at work. People will make fun of you because they think you're older and you do not need to have the same recognition, and they will choose somebody younger, a younger man or a younger woman in that situation. So really it does depend upon where you are living, how menopause is approached. But however it is a very individual experience. And so we have to understand that that is something that we want to acknowledge. Oh, sorry. This is the same theme. Just imagine doctors, 2,000 female doctors were questioned, and the vast majority said they did not get any support. So if that is the state for women doctors, can you imagine the general public? So people have always felt, there was a very good report by Channel 4 television called the Fawcett Report, and they found that a lot of women are leaving their jobs because they don't get support. And the same thing was there even in the US. Basically, all over the world, we find that doctors don't have time to listen to women when they come with their menopausal symptoms. They're often told that they should not have hormone replacement therapy when it can actually be life-changing. A lot of doctors still think that HRT can cause cancer, which is a myth. HRT is safe. It's safe for almost every woman, and it's important that doctors know this information and that the public know this information. Because your friend might come and tell you, you know what, I'm really suffering from these symptoms and I'm thinking of taking HRT, and you as a friend or as a slightly older person will say, no, 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 don't have HRT. We have heard it causes cancer. No, it does not cause cancer. And so it's important that the right information is given to you by the right people. So don't have misinformation, because it's so easy to believe something and deny yourself something that can actually help you. So I'm now coming to somebody who is 46 years of age. She says that she has noticed that her periods are getting more frequent. So normally most women will have periods between 26 days to about 30, 32 days, any range between that. Now, if she starts saying, you know what, I have noticed that my periods are coming every 24 days or every 25 days, or previously I used to have 30-day cycles, they're now 26-day cycles. She's also noticed that in January she had a period, nothing in March and April, and then again she started having some hot flashes, low mood, she didn't feel like having sex, her husband was getting irritated with her, and suddenly all her symptoms got better again. And in June, July, August, her periods came back to normal. This is what is known as perimenopause. So generally speaking, women will notice that their periods have come closer together. Some women may notice it's got heavier, and that is usually because they will have conditions like adenomyosis or endometriosis, which are chronic conditions that can make it even worse during menopause and perimenopause. But generally, for most women, they will find that the average age of going into perimenopause, is it all right? Yeah. Um, they find that going into perimenopause tends to occur around age 47. But for women of the Indian subcontinent, we know that menopause can occur often between the ages of 45 to 47. Okay, and perimenopause can occur 2 to 8 years before. So perimenopause is the time when you're leading into menopause, stopping your periods. Okay, so perimenopause is a gradual change unless somebody like me does a hysterectomy for somebody and takes out your ovaries, so you will go into sudden menopause. But otherwise, perimenopause is the time that you're going into menopause. You're still having periods, but you may have some hot flashes, you may feel tired, and usually that age is 47. But it can be anywhere between 2 to 8 years before your periods completely stop. So if you're an Indian woman whose period is meant to stop, is destined to stop at say 46, perimenopause can start in your late 30s. And if you are a lawyer or a doctor or a high-powered career woman, you may not even have started your family at 37, 36. So you might actually be entering perimenopause when the number of eggs are dropping in your ovaries. And so fertility can be a real challenge for women in the perimenopause. It's not that easy to get pregnant. So while the average age is 47 years, it can be as young as 36, 37 years for perimenopause. And the other important thing to understand is this is the time when the ovaries start to fail, okay? And they start reducing their numbers of eggs. You're born with 2 million eggs when you're 20 weeks inside your mother's tummy. By the time you're born, you have about 1 million eggs in both ovaries. By the time you reach puberty, there are several 100,000. And over the time, by the age of 35, 36, the number of eggs start dropping quite rapidly. That's why it's harder to get pregnant in your late 30s compared to somebody in their early 20s. And women notice that they're having menstrual irregularities, they may start bleeding in between, they have hot flashes, but also more importantly, bone loss and cholesterol changes can start in your early 40s. So it's important to get checked out with your doctor. If you're above the age of 40, make sure that you know what your cholesterol levels are, what is your triglyceride levels, make sure that you know what your blood sugar levels are. So perimenopause is the time when it's leading into menopause. Menopause is the stopping of periods. But you can only say that you're menopausal 1 year after your periods have stopped. You need to have a whole year. So if you are, say, 47 and you have not had a period for a whole year, then you can say, I'm menopausal. And you remain menopausal for the rest of your life. You never finish with menopause. In fact, the life expectancy of women in the US and UK is about 80, 83 years. About 80, 83 years. So we have about 30 years from the age of 50 until the age of 80, 30 years that we are going to be menopausal. So we have to do many things to try and help our health, because you don't want, dementia is the biggest killer, for example, in the UK for women. And in US, dementia is also rising, and most people who suffer from dementia tend to be women. So we know that diet, lifestyle, your hormone levels, all these play a very important role in preventing dementia. So what happens in menopause? It's a retrospective diagnosis, which means that my periods have not come for 1 year, now I am menopausal. But if you are under the age of 40, we have to do other tests to make sure that you don't have thyroid issues, you're not pregnant. There are many other conditions that we have to talk about. But basically, the estrogen levels start falling because the number of eggs in your ovaries have dropped so low that they're not producing the hormones estrogen, which is so important because estrogen receptor is present in your brain, is present in every cell of your body. So that's why women will say, I have brain fog, I can't remember everything very well, I am feeling a lot of body ache, because the estrogen levels start dropping in menopause and in perimenopause. Okay. What are the common symptoms? There are so many symptoms. Most women will have a handful of these. Some women will have none of these. Nobody will have all of these. Okay? But hot flashes tend to be the most common. You have a sudden onset of heat and you feel, really hot, lasts for 30 seconds, usually sometimes up to a minute. You can have one in a day. You can have several hundred in a day. You may wake up at night and have night sweats. Everybody else is, under the duvet while you are, peeling off all the clothes. You may notice lack of concentration. You may have brain fog. You may not want to have sex. You may have painful sex as the estrogen levels drop. You may not be able to sleep at night. You may be very tired. You may have stress, depression, and often I'll see doctors giving antidepressants to women in menopause. No, they need HRT. They need hormone therapy. They don't need antidepressants. Women may also notice things like needing to go to the toilet more often, increased passing urine. They may notice that they are more constipated. They may notice ringing in their ears. They may have like a crawling sensation under their skin. They may notice that they're putting on excess weight. They may have joint pains. They may have heart disease. Sorry, just drink this. That's fine. And long term, so when women say, I've finished with menopause, Dr. Bajekal, I don't need to come to your talk. I don't need to read your fact sheet on your website. No, because osteoporosis, dementia, heart disease. Did you know that more women die of heart disease in the US than men? Same thing in the UK. Men tend to die a bit earlier, so it's talked about more often. But more women die of heart disease than men. That is really important. And also people will find that they may have balance issues. They're not able to stand. Ideally, you should be able to stand on one leg for about 12 seconds to know whether you have a good working heart. Also, osteoarthritis. All these things are important. Osteoporosis. So it's important to get checked out. If you have I don't know how the healthcare is in the US, but I suppose all of you can have, Medicaid and Medicare and things like that. So you should be able to access and know what is your bone density. Are you osteoporotic? Do you have any heart conditions? What is your cholesterol level? What is your blood sugar level? Because especially in the Asian community, diabetes is a real problem as well. So we talked about hot flashes. That's the most common symptom of menopause. And you can have sweatings, you can have cold flashes as well. You may feel cold after you have the initial heat. How do we diagnose menopause? After the age of 45, I just need to take a very good history. If you tell me you have not had periods for a year, you are having these symptoms, I don't need to do any blood tests to diagnose menopause. But if you're under the age of 40, I myself was 38 when my period stopped. That's a medical condition called POI, premature ovarian insufficiency. That needs full investigation, and you have to be on hormone therapy and medication. Sadly for me, the US had come out with a big study which the media misinterpreted as if it causes cancer, and so all of us were not given HRT when we should have been given HRT 28 years ago. So in the early 2000s, this paper came out and everybody was taken off HRT. Now we know that hormone therapy is actually safe for the vast majority of people, and most people can have it, in their late 40s and early 50s. So we now come to lifestyle medicine. So Usha is a 48-year-old woman. She notices that her periods are coming more frequently. She has some night sweats. She has some hot flashes. Her mood is low. Her periods are not heavy, so she doesn't have any other conditions like fibroids and things. She has been investigated for that. She's struggling with her weight. She has a sister and an aunt who has breast cancer. So she's worried about hormone therapy. She does not need to be worried. Just because there is a family history does not mean that she cannot take hormone therapy if she wanted. But she doesn't want to take it, and that's absolutely fine. She wants to avoid HRT for now, and she wants lifestyle advice. So that's why she has come to the doctor. So what is lifestyle medicine? How many of you in this room have heard the term lifestyle medicine? A few of you. Most doctors also haven't heard it. But it's actually, there is a very good definition by the American College of Lifestyle Medicine. I was one of the first I was the first OBGYN in the UK to have done the degree, along with my husband, who's an orthopedic surgeon, and then there were several primary care physicians as well. But lifestyle medicine uses evidence-based. So it is not because Nitu Bajekal has said, eat tofu, that's why it's good for you. No, it has to be scientific. It has to have evidence. So it's the use of evidence-based lifestyle approaches that help you to treat, prevent, and sometimes reverse chronic conditions. So think of a chronic condition. Think of things like high blood pressure or diabetes. These conditions can be controlled very, very well using lifestyle. You may need medication, but you can take down those medications or completely stop them in some situations by having the right diet, the right lifestyle. You can't just do diet, you have to do all the 6 lifestyle pillars, but it is so empowering for people to know. And the beauty about lifestyle medicine is it is not alternative medicine, it is not functional medicine, it runs alongside Western medicine. Okay, which means that we want you to use tablets, we want you to come to see people like me when you need surgery for endometrial cancer or large fibroids or endometriosis. So surgery has a place, medications has a place, but lifestyle has a huge place, and for some people that is all that is needed. And the other big difference between Western medicine and lifestyle medicine is that you, the person, is in the center. You are in the driving seat. See, when you go to see a doctor and you've gone for a medical condition, the doctor will tell you whether you need surgery, whether you need medications. With lifestyle medicine, you are the driver. You decide how much you want to do, whether you want to go for a walk, whether you want to go for a run. Nobody is telling you anything. You decide whether you want to eat that samosa or would you rather eat that piece of apple. So you are the person who's deciding. So self-care and self-management is the key, and it is very, very empowering because you can decide how much you want to do. You might want to take baby steps, you might want to take a big jump. Okay? It's not your doctor who decides. While in the Western medicine, the doctor is in the driving seat. I am telling you whether you need surgery. I am telling you whether you need tablets. But with lifestyle medicine, you are deciding how much you want to do. I want to sleep 7 hours every night. You are deciding, nobody else. You understand? So what are the 6 lifestyle pillars? This applies to all the medical conditions that you can think about and every women's health condition that you can think about. So the 6 pillars that you can apply to your life, the first one is trying to eat more plants. Okay? And the less processed those plants are, the better they are for you. And this is not me saying, this is the global burden of lifestyle disease, which was presented in the Lancet. They looked at 175 countries and they found that 11 million deaths could be avoided if you just ate more vegetables, more whole grains, more beans. So eating more plants is one of the first lifestyle pillars, but it's not enough. Just having a good diet is not enough. Okay? It's like a domino effect. So the next lifestyle pillar, moving your body. Okay? So can I ask everybody to just get up and stand up and just do some leg raises or calf raises? Yes. Because every half an hour, you carry on sitting for more than half an hour, your cholesterol levels start rising, you start feeling much more unwell. So try and remember this. When you're at work, you can sit down. So when you are boiling the kettle, when you're waiting for your lunch to heat up, what you can do is do some, you can walk around, you can do some burpees, you can do some star jumps, you can do all that. You can sit down now, okay? It's just to allow the blood flow to move. And it's so important. So The first one, as I said, is eating more plants. The second lifestyle pillar is moving your body. It doesn't have to involve going to the gym, but it involves moving your body. And I'll be going into each of these lifestyle pillars. The next one is making sure that you get good quality sleep. Okay, and that is very hard for women in menopause because the estrogen levels drop and you have hot flashes and you can have mood changes. So sleep can be a real issue, and you have to have some kind of sleep hygiene pattern so that you can get good night's sleep, because when you sleep well you will do a lot of things much better. The fourth lifestyle pillar is learning to identify stress and managing your stress. All of us have stress. We all have annoying husbands and annoying children and annoying bosses at work. You've got to find a way to identify it and manage it so that you can be as calm as possible. Because when you are stressed, acute stress, when I'm doing a talk like this, that's fine. But if you're chronically stressed, your cortisol levels are raised. And so as a result, that will increase a whole lot of inflammatory markers in your body. The fifth lifestyle pillar is trying to avoid risky substances. So whether it is drugs, whether it's alcohol, whether it's smoking, whether it's vaping, you want to keep these at a back burner. If you are going to indulge in any of these things, they have to be very rare. There is no health benefits in any of these risky substances. And the last, probably one of the most important pillars in my book, is social connection. Loneliness causes more deaths from heart disease and other chronic conditions than anything else. And we know that as a nation, as a world, we are becoming more and more lonely because of social media. We are happy to sit with our phones. We are disconnected. So having gatherings like this, laughing with a friend, going for a walk with a friend, these things are so, so important, because keeping socially connected means that you keep your brain active. So remember what I said about a domino effect? So when you stress less, or say you start sleeping well, when you sleep better, you wake up in the morning, you're less stressed. When you're less stressed, you're more likely to go for a walk or do some exercise. When you come back from that exercise, you're more likely to want to eat a salad rather than eat a donut. You understand? So everything is interlinked. All the when you're less stressed, you're less likely to reach for umpteen cups of coffee or the glass of alcohol. So, or eating that bag of chips. So it's understanding that when you do one lifestyle pillar, the other one gets lifted up as well. Same thing, when you are stressed, you tend to eat badly. So you will reach for that glass of wine, then you will want to order a takeaway. And so when you're doing that, you then feel that you've put on weight, you don't want to ring your friends, so you're not talking to anybody else. As a result, your sleep gets disturbed. And when your sleep is disturbed, then you don't want to go for a walk or do any exercise. So you can see a good lifestyle habit will boost all the other lifestyle pillars, and a bad lifestyle habit also will negate and make all the other lifestyle pillars harder to achieve. I don't like to label foods good or bad, but we will talk about diet. Now, this is really important. 1 in 4 deaths globally is responsible because of unhealthy diets. 75%, 3/4 of the world's population, urban populations, are now either obese or overweight. And you know the US has a particular problem. So, and also for Asians, although you may, Indians and people from the Asian subcontinent, our BMI is cutoff is not 25. Our cutoff BMI is 23. So we have to understand that we are at much higher risk of chronic health conditions than maybe others in your neighborhood. So you do have to take extra precautions rather than thinking, you know what, this is just once in a while. Because if you don't pay attention to the food that you put in your mouth, sooner or later it catches up with you. And 60% of what we put in our shopping trolley consists of highly processed or ultra processed foods and drinks. So try and keep away from those fizzy drinks, those juices, those aerated drinks. They're not good for us. Try to stick to water wherever possible rather than drinking, liquid calories. 80% of people find all the information that is there on television and in the papers very confusing. 1 minute they're told ghee is good. 1 minute they're told butter is good. 1 minute they're told that, soya is bad. So people get very confused, and this is deliberate. This is done by the industry so that you remain confused and you go back to your original eating habits. And also remember, as humans, nobody likes to hear bad things about their bad habits. They want to hear that how bacon is good for us, right? So that is important to remember. And so when there are conflicting information, everybody goes back to their original way. And as I said, 3/4 of the world's population tends to be carrying excess weight. And this is a particular problem in menopause because it increases our risk of type 2 diabetes, high blood pressure, dementia, which is known as type 3 diabetes. The risk of certain cancers, breast cancer is increased when, in fact, there are 7 different cancers that are increased from just drinking alcohol. And carrying excess weight is second to smoking. So there are so many increased risks for women when we hit menopause with increasing weight. And that increased weight comes from several factors, including the hormonal fluctuations. But also as we get older, we tend to eat out more often because now we are more free. We are not having younger children to look after. We are also tend to be sedentary. All studies have shown that the group that is the most sedentary, that means not getting up and doing exercise or walking around, is the Asian women group. And that is worrying for us. You know, we feel shy to go for a walk or to the gym if you're carrying some excess weight. So try and get out there, find a buddy so that you can actually do some exercise. Stress, alcohol, socioeconomic factors, if you don't have enough money, all these things will worsen the menopausal symptoms of putting on excess weight. Interestingly, I've just put this up, but of the 10 leading causes of death, the vast majority are lifestyle diseases, all of which can be prevented. Isn't there hardly any infections? COVID-19 was the only one. Everything else you can actually be affected with lifestyle. So that's important to just, be aware of this. Has anybody heard of the blue zones? Yeah. So I was fortunate enough to go to Japan, but we have a blue zone right here in California in Loma Linda. But this is the place, 5 places. Nowadays, of course, sadly, the Western civilization has come to all these places, and so they do have a higher death rate compared to before. But the key about these 5 places, in Okinawa, in Nicoya, in Ikaria in Greece, in Loma Linda, in Sardinia, these people move their bodies by doing natural work. They do gardening, they go cycling, they look after their children, they tend to their gardens. They tend to eat 95% of their food comes from plants. So they may eat sweet potatoes in Japan and Okinawa. They may eat sweet corn in Costa Rica. They may have pasta in Italy. So most of their diet will come from complex carbohydrates and complex plants. So this is one of the key things they found with blue zones that Dan Buettner, who's done all the work for the blue zones, found that beans tend to be one of the staples in blue zone diets. And that's something that we can actually adopt. So we'll now come to the different lifestyle pillars. The first one is nutrition, okay? And you can see what a beautiful vegan meal I'm having in Japan. I tell you, I've never eaten such good food, such pure food. So what do we tell people to try and focus on? Now, I don't expect everybody to eat 100% plant-based straight away. What you must do is try to inch towards a plant-based way of eating. Why? Because we know without any doubt that if you can eat predominantly plants or exclusively whole food plant-based, we know that that is probably the best way of maintaining and optimizing your health, whether it's menopausal health, whether it is heart health, whether it is gut health, whether it is bone health. You will know that by eating anti-inflammatory foods, you will actually reap the benefits hugely. So what foods should you be focusing on? Foods that are rich in fiber, which means all whole fruit, all vegetables, all whole grains. You can have anything from ancient grains like millet and amaranth and things like that, or quinoa and rice, or as well as tubers. You want to try and have a lot of potatoes and sweet potatoes, not fried, not chipped, but baked or boiled, because, and especially when you cook your potatoes, put them in the fridge and eat them the next day. That improves the resistant starch. and so actually makes the glycemic index even better. You want to eat yam and sweet potatoes, you want to have a lot of beans, and under the beans you want to have a significant amount of the king of beans, which is soy. Soybean is one of the best things you can add to your diet when you leave home today. When you leave this talk, there are a couple of things I want you to remember. One of them is all about soya. You want to have no meal in a day without putting herbs or spices on it. So if you're eating a bowl of porridge in the morning, put cinnamon powder into it. If you're having a dal in the afternoon, make sure that you put coriander or basil or parsley. You have to have, the more spices you put in, the better it is. The less oil you use, the better it is. While extra virgin olive oil is great for many, many health benefits, remember that most people are trying to lose weight, and 1 tablespoon of oil is 120 calories. Okay, so while that is great if you're trying to put on weight, or if you're an older person who's quite frail, or if you're a young child, extra virgin olive oil is great. And ideally, you want to have oil in the cold pressed variety. So, cold pressed extra virgin oil, cold pressed avocado oil, these things are important. But for the vast majority of people, learn to make, so on my website, and you can see, please, if you can note down at some point later, my website has got lots of free recipes, lots of free fact sheets. I'm also very active on Instagram and TikTok, where I put a lot of recipes on. So you can learn how to cook oil free if you want to, and then use your oil as condiments, just like salt and sugar. Sprinkle it on top rather than using it as a base. Try to avoid sugar sweetened drinks and fruit juices and refined grains. Try to avoid ultra processed foods like deep fried samosas and things like that. Try to specifically avoid animal foods, including dairy. I know a lot of people here are vegetarian and focus on dairy, but dairy does not really bring health to the table. Okay? What dairy does is it has got saturated fat. Yes, it has got protein. Yes, it's got calcium. You can get that protein from all the plant proteins that we talk about, whether it is beans, whether it is tofu, whether it's tempeh, whether it's um, just put it on silent. And so you want to really be avoiding foods. So if you're somebody who eats eggs, try to limit it to 1 egg a week. Maximum 2 eggs a week. Why? Because we know for men, eggs increase the risk of prostate cancer. We know that dairy, even a cup of milk or yogurt, increases the risk of prostate cancer, aggressive prostate cancer, by 25%. While a man who has soya milk has a 25% reduction in prostate cancer. Soy yogurt, edamame beans, tofu, these are all produced from soy. So it's really important that you actually think about the foods that you're putting in your mouth. You don't have to go 100% plant-based, but the more you can actually bring these foods into your diet, you will find that you have so much more energy, so much better, you feel better. And this is especially true for menopausal women who are putting on excess weight, because when you eat a whole food plant-based diet, what happens is you're eating a calorie light but nutrient dense diet, which means you have all the vitamins, all the antioxidants, all the fiber that feeds the good gut bacteria, but actually it's low calories. Okay, when you're having a big soup, when you're having a salad, when you're having dals, you are having low calories. So that automatically will help you to lose weight and will help you to keep the weight off. So it reduces inflammation, it regulates blood sugar when you eat whole plant foods, it helps you to maintain a healthy weight in menopause, it helps you to keep your cholesterol levels normal, it helps to feed the good gut bacteria, it helps you to improve your immunity to fight autoimmune conditions. Because remember, again, most autoimmune conditions, whether it's lichen sclerosis, whether it is rheumatoid arthritis, whether it is multiple sclerosis, tends to affect women more than men. So you want to be eating foods that reduce inflammation, because inflammation is the building block of all chronic health conditions. So you want to reduce that inflammation. So when you look at your plate, you want to make sure that your plate has, half the plate has got fruits and vegetables, keep water as the drink of choice, have lots of plant proteins, and here you should have things like nuts and seeds and chickpeas and all kinds of beans and edamame beans and tofu and tempeh, and you want to have whole grains over here. So this is how you should try to eat most days. and you can make them into different culturally appropriate dishes. But this is the idea, that this is how your plate should look like. This is from Dr. Neil Barnard's team, and you should add herbs and spices. How does it help in menopause? Study after study after study has shown that women who have a whole food plant-based diet or eat mostly plants have lower chance of having menopausal symptoms. They don't have so many hot flashes. They don't put on so much of weight. Women who, on the other hand, have lots of butter and paneer and cream and snacks tend to suffer much more from menopausal symptoms and as well as unwanted weight gain. So here I want to talk a little bit about soy because there's a lot of confusion about soy. Now soy is a bean, just like your kidney bean, just like rajma, just like chickpeas. It's a bean. It's been around for 5,000 years all over the world, but especially in China, and all the Southeast Asian countries will eat it. Why is soy so good? Because it has the same amount of protein as egg white. Anybody who goes to the gym knows that all the gym bros always want to have egg white omelette. Okay, but can you imagine that actually soy and tofu has more protein than egg white? So that is one of the big reasons. The second very important reason for men and women is it is anti-cancer. Why? Because it has plant estrogens. Soy is not the only thing that has plant estrogens. Blueberries have it, raspberries have it, pistachios have it, flaxseed has it, chia seed has it. But soy has it in the best proportion and the best amount. So it has the best quality of protein and the best quality of phytoestrogens. And so although plant estrogens are present in chickpeas and all other beans and in lignans are present in flaxseed, we know that soy is probably the best source of giving you plant estrogens, which are not the same as the estrogens when you drink dairy. So when you imagine a baby calf is born at about 30 kilos. A human baby is about 3 kilos, right? And so the human baby is fed the mother's breast milk. That has got a certain amount of protein, certain amount of calories, certain amount of fats. Cow's milk, on the other hand, that baby cow from 30 kilos has to become 300 kilos. The human baby has to be from 3 kilos become 60 kilos. So the proportion of hormones, estrogen, the amount of protein, the amount of fats, the amount of saturated fat, all that is in a very high amount, which goes straight. And we know that for men, there's 25% increased risk of aggressive prostate cancer. And we know more and more from studies, there's a very strong link between dairy and women's breast cancer. So if you are not a baby cow, and even baby cows do not have dairy after a few months. So that is why you must think, why am I having dairy? Just because my grandmother had it? No. You want to make sure that you have something that gives you the best chance of optimizing your menopausal symptoms, optimizing your health. And that is through having plant-based milks. Now, of course, almond milk, oat milk, rice milk, these are not very nutritious milks. They are better than dairy milk, but they are not good compared to soy milk. So if you have to choose a milk, ideally you want to choose soya milk. Ideally you want to have, instead of paneer, you want to have tofu, tempeh. Every day you must try to have a handful of tofu. I tend to have 4 portions of soy every day because I do a lot of strength training as well. So I don't want to go deep into the action of soy, but the beauty about soy is it works on just the beta receptors compared to the mammalian estrogen. So when you carry excess weight, your body fat has a lot of excess estrogen. The same estrogen that comes from dairy milk and beef and chicken and things like that, that mammalian estrogen works on both alpha and beta receptors. So it increases the chance of many cancers and osteoporosis and things like that. While soy actually builds your bone, builds your breast, reduces your risk of all the cancers that I'm going to talk about in a minute. But just to talk about menopausal symptoms, we know that having a handful of edamame beans or a handful of tofu every day can reduce menopausal symptoms by 80%. So it's really useful to try and bring it. When should you introduce soy? If you are hearing about soy for the first time today, please introduce it from tomorrow. But if you have a small child, a grandchild, you want to actually start introducing soy from childhood, because we know that children who are eating soy regularly have the lowest risk of breast and prostate cancer. But eating soy regularly also reduces bowel cancer, ovarian cancer, endometrial cancer, liver cancer, lung cancer. And we know that women who have a history of breast cancer, when they are on medication, or even if they're not on medication, those women who eat soy have a 38% less chance of dying from the breast cancer coming back. And that is such an important, powerful information to have. Same way, try to aim for 2 to 4 portions a day. What is a portion? What you can hold in your hand. So a handful of edamame beans, a cup of soy milk is 2 portions. Or a handful of edamame beans and a handful of tofu or tempeh or miso soup. Any of that will give you your 55 milligrams of isoflavones that will help to protect you, your breasts, as well as build your bones. So this is important to know these simple facts so that you can not be scared of adding soy to your diet. And people often say, but Mrs. Bajekal, you're telling me to go on a plant-based diet, but what about my protein? I need my chicken breasts, I need my dairy, I need my eggs. No. If you think about it, you can eat it because you like the taste, that's fine. But don't eat those products thinking they are good for your health. You want to bring in plant proteins. And if you look over here, as I said, tofu has more protein than eggs. Eggs has about 12 grams. This is per 100 grams. Seitan has 75 grams. It's very, this is wheat gluten. So it's not good for people with celiac disease, but otherwise people like me, I can eat a lot of seitan. Tempeh has got even more protein than tofu. It's a fermented form of soy. You can have textured vegetable protein, soya chunks. You can have mycoprotein, soya milk, edamame beans, quinoa. The list goes on, okay? And you want to aim for 1.5 to 1.6 grams of protein per kilogram. So about 100 grams of protein per day. Most Asians don't reach it. And especially if you are somebody who is lifting weights, you want to aim for at least 1.6 grams per kilogram. Because one of the biggest reasons for death, especially for women, is a hip fracture. Once you have a fracture of the hip, 50% of women will never make it to the next birthday. Okay? So that is such an important thing. Hip fracture, breast cancer, dementia. These are the 3 big killers. What can help to heal it? Through lifestyle medicine. Also very important to eat with your circadian rhythms. Aim to get morning light. So as soon as you get up, however dark it may be, as soon as you see some sunlight, try to let that sunlight go through your eyes, because that will help to depress your melatonin, and then the melatonin will rise later on. We know that as soon as you eat, after that, for 5-10 minutes, if you walk around, your blood sugar levels are much more normal. You see men, they will often eat and they will go from one chair to the sofa and they'll sit down. There is a reason why men tend to die 10-15 years earlier than women, because they tend to get more of the fried foods, more of the choice cuts of meat. They tend to be less sedentary. The woman gets up, she has to clear the dishes, she puts it in the dishwasher or she washes the dishes. She's mobile on her feet. And so we know that you want to be mobile on your feet. You want to front load your calories, which means you want to eat a large breakfast, a large lunch, but not, and you must eat a light dinner. Why? Because it takes time to digest overnight. And night is a time when good sleep is so important, because during sleep, all the DNA junk is cleared from your brain. So you don't want to go with a heavy stomach to bed. You'll have more hot flashes, more night sweats. You will also be uncomfortable. So you want to eat at least 2 to 3 hours before you go to bed. And it's important that you, as I said, breakfast like a queen, lunch like a princess, and dinner like a pauper. Okay? Try to eat by 7 p.m. And you should try to have intermittent fasting for about 14 hours, where, you know, if you have your dinner by 7 or 7:30, you don't want to eat till about 8, 9 o'clock the next morning. So that way, and so having tea with milk is still considered breaking the fast. You can have black tea or black coffee or a herbal tea or a glass of water, but you can't have anything with some calories in it. The other very important thing, has anybody heard this term, hara hashibu? This is where you get up from the table about anywhere between 60% to 80% full, which means that if somebody forced you, you could probably eat a bit more, but you want to get up slightly not so full that you can't walk. So 80%, And actually, when I spoke to the Japanese when I was in Japan, they say 60 to 65% is what they aim for. So they are not eating so much that they are so full. And night dinner especially should be light. So when you eat slightly less, you will find that your metabolism is much better. For those of you who fast or who have done water fasting like I often do, you will find that you actually have more energy on the days that you fast. So it's just understanding how the metabolism works. So we talked about food. You want to try and aim for minimally processed whole plant foods as part of your nutrition, eating early in the daytime, trying to eat calorie light foods that will help you for optimizing your health, whether you're a man or a woman. But there are 5 other lifestyle pillars that we'll talk about. And it's never too late. People say, oh, I'm 80. My 96-year-old friend, when she was last year, when I published my book, she read the book from cover to cover, and she said, she's the one who had said to me the year before when I was writing, she said, it's never too late and never too early to make changes in your life. So you can make changes even when you're 90. Sleep. How many of you would say in this room that sleep is an issue for you? I definitely find that sleep, I have a very active brain. I have to make real effort. This is the one lifestyle pillar that I fail every single time. So it's so important not to scroll on your phone, keep your phone in another room, listen to calming music, maybe have a cool shower if it's a hot day, try to eat early, try to have either a eye mask or thick curtains, try to make sure that you get early morning light so that your melatonin levels start rising in the evening. Very simple things. If I drink coffee or tea or even have a sip of wine and coffee and tea after 10 o'clock in the morning, I will not get sleep that night. So you have to know your body, but generally speaking, you want to do that. You also want to restrict your fluids at least 2-3 hours before bedtime. So drink all your water and everything before 7 o'clock, so you're not getting up several times at night to go to the toilet and disturbing your sleep. So we've done food or nutrition, we've done sleep. The next lifestyle pillar is exercise. As I said, you don't have to go to the gym. If you can go to the gym, that's great, but now you have so many YouTube videos and things that you can do without having to pay, so that's not an excuse anymore. Why is it so important to exercise? Not for losing weight. Exercise does not help you lose a single gram of weight unless you are Usain Bolt or, one of the top elite athletes who are exercising 6 to 8 hours a day. Exercise helps you to maintain weight loss. It doesn't help you to lose weight, but it is so good for mental health, for all physical health benefits. It reduces cancer risk from coming back. It helps menopausal symptoms. It helps period pain. It helps improve insulin sensitivity and blood sugar levels. It helps in so many ways of improving the quality of your life. What it does not do, please do not listen to people who tell you that exercise will help you to lose weight. You have to exercise crazy amounts. And so people will often go and walk on the treadmill for half an hour, come back and eat a bar of chocolate. That's it, gone. Okay? So just remember that that is an important thing. How much should you be exercising? I would recommend you try to do some form of exercise for 60 minutes a day, 1 hour a day. Plus, so one thing I said that I want you to remember when you leave this room is bringing in soy into your life. So eating tofu or soy milk and edamame beans. The second is doing strength training. It is not negotiable. If you're above the age of all children should also be doing strength training, resistance training with the help of weights, resistance bands, yoga, Pilates, using your own body weight is really key to prevent osteoporosis. So skipping is very important, jumping up and down, because that helps to cause micro damage to your bones and helps to make your bones stronger. Because osteoporosis is where the bone gets thinned out. You can see a nice normal looking bone and look how many holes are there. Can you see big vacuums? So this osteoporotic bone is easy to crack. And so that's what causes hip fracture. So a woman in her 50s, if she falls and breaks her wrist, that tells us she's most likely going to die from a hip fracture. She's already got osteoporosis in early menopause. So, and we know that the highest group of people who have osteoporosis are people from the Indian subcontinent and Scandinavian countries because we have the most amount of dairy. Dairy is linked to osteoporosis. So you want to be aware of that. And also previously, whole food plant-based or vegans had high risk of bone fractures because they did not take B12 and vitamin D and weren't aware of the importance of weight-bearing exercises. So the second thing that I want you to all remember is go home and download whichever weight bearing exercise YouTube video you want. If you can get a personal trainer, that's great, but you do want to learn how to lift weights. And if you're somebody who goes for lots of walks, try to get ankle weights, wrist weights, and a vest as well, especially if you're quite small and slender. It's really important that you're focusing for men and women, for children. It's one of the key things because as soon as you become sarcopenic, which means you lose muscle, I know a lot of 60-year-olds, I'm 63, I know a lot of 63-year-olds who are very frail and thin and slim, and that is not good for bone health. Okay, so you have to be lifting weights, not having excess fat, but lifting weights is so important, and doing balance exercises, Tai Chi and things like that, because falling down is one of the big problems. And then when you fall down, as any nurse will tell you, or any doctor will tell you, hospital falls or falls at home are really a big problem for older people, and then having hip fractures. So you really want to start early and build your bone by having foods that are anti-inflammatory, so lots of vegetables and fruits, especially things like oranges and green leafy vegetables, lots of things like sesame seeds, they all contain a lot of calcium, tofu contains a lot of calcium, so you want to be eating foods like that. Prunes, dried plums, 2 prunes have been shown to help with bone strength, so add that to your porridge along with a tablespoon of flaxseed powder in soya milk. So make sure have a tofu scramble on the weekends. Simple little things like that will really change. You don't have to give up your egg if you don't want to. You don't have to give up your paneer if you're eating it once in a month. But try to replace these things slowly so that you can actually realize how much of energy you will have when you eat foods like this. What about stress? We already talked about stress, so identify stress. If you're in a bad marriage, leave the person. If you find that, it's true, don't waste your time. Life is short, okay? So if somebody is not good to you and hasn't been good to you, don't hang about with them. Same thing with friends and family. Any friend or family that brings negative energy to your life and drags you down, you don't need them in your life, because that will cause you much more heartache. Surround yourself with people who lift you up, not people who drag you down. So identify your stress, find ways. Is it exercise? If I go for a morning run, do I feel better? Yes. If I actually walk in a park, do I feel better? Yes. So reduce your stress. If you're somebody who has to go home and cook the dinner, look after the children, look after the in-laws, sit in your car for 5 minutes, do some breath work, do some chanting, do some meditation, then go in. Nothing is going to happen in 5 minutes. Because once you go home, your time is no longer yours. You're below the dog. Okay? So you want to make sure, it's true. Our dogs are right at the top. Luckily, my husband is below me, so that's fine. So he does all the work, so it's good. But you really want to make sure that you have a gratitude practice. People are always saying, oh my God, I am so unlucky. I haven't had this. I've got high blood pressure, or I have so much of work. Well, the fact that you're living in the US, already you won the lottery. The fact that you're breathing, another lottery. So think about it like that. And then try to do good. Try to do some charity work. Try to smile at people. You don't have to always give money, but you can go and help an elderly neighbor. Maybe if you cook a nice dish, you can go and give it to the local Gurudwara, whatever. You find ways of actually reducing your stress by helping other people and remembering that social connection that we talked about. Also, you may need to reach out for medical things. So you may have to do cognitive behavior therapy, you may have psychotherapy, you may need medication, you may need hormone therapy. These things are important. How are we doing for time? Okay, so I should stop. So the last thing is building positive connections, and we've talked about that, and avoiding risky substances, because barbecued food and these can really cause problems, advanced. Right. Do not be fooled with alcohol. No amount of alcohol is safe. Do you want me to touch on hormone therapy? Is anybody interested? Otherwise, okay. So, Susan is a 52-year-old woman who's had no periods for a year. She's struggling with hot flashes. She has no risk factors. She's interested in HRT. Now, few things, I have a whole fact sheet, several fact sheets on my website and in the book, but basically the take-home message is HRT is safe. The current medications that we have are all body identical, which means that they mimic what hormones we have in our body, the estrogen, the progesterone, the testosterone. And so it's important that you see a specialist who can actually talk to you. There are very few people who can't take HRT. Those are people who have a personal history of breast cancer. If you're above the age of 60 and you want to start HRT for the first time, we don't usually recommend it because we don't have the studies. And for those who have clotting disorders, that's important to understand. Yeah. And so there are many varieties, but if you still have a uterus, that means you haven't had a hysterectomy, you need estrogen and progesterone, and you start with the lowest dose and you slowly increase it. Ideally, we tell people that you should have it anywhere between 2 to 5 years, but I have patients who've been on it for 20 years, 25 years, and it's a very personal choice. The risk of cancer is extremely small, it's not something that one needs to worry about. Much more worrisome is the intake of alcohol or excess weight. That will increase the risk of cancer much more than any hormone therapy. There are alternatives to HRT, so CBT, acupuncture, meditation, yoga, hypnosis, all these things are important, and you might want to, look at these if you're not able to take HRT or alongside HRT. But lifestyle is again very important. What supplements should all of us be taking? B12 if you're above the age of 50, vitamin D3, get your levels checked, and you can take anywhere between 1,000 to 4,000 international units. I tend to take 2,000 every day, and I add 4,000 a couple of times a week. So because you want your levels depending upon which part of the world. So USA is usually about 30, you want it to be above 30. Iodine, in UK we don't have iodized salt, so I recommend taking an iodine supplement, but otherwise in the US, anyway you want to keep your salt to a minimum. So seaweed can also give you some iodine. Do not take calcium supplements because we know that, especially for postmenopausal women, it can increase the risk of heart attacks. You want to get your calcium from, sesame seeds and tahini and green leafy vegetables and tofu and oranges and things like that. So if you are suffering from hot flashes and you want to do just diet and lifestyle, turn the heating down, layer your clothes, cooler showers, meditation, avoiding alcohol, eating soy products, whole food plant-based diet, and then in some people, HRT or hormone therapy is needed. Breast cancer is very common. 1 in 7 to 1 in 8 women will be diagnosed with breast cancer in the US. Most of them, some of them you can prevent, especially 10%. So 1 in 10 women have breast cancer because of excess alcohol, 1 in 10 because of carrying excess body weight. And we know that dairy also has a role in breast cancer. So remember to try and include these foods in your diet. These are the cancer busters or cancer G-bombs. So greens, beans, onions, mushrooms, berries, and seeds. These are the G-bombs. This is soya to reduce your risk of cancer, flaxseed to reduce your risk of breast cancer, green tea to reduce your risk of breast cancer, lots of turmeric and other herbs and spices to reduce your risk of cancers as well as reduce arthritis. Risk of dementia, same thing, lifestyle, having a lot of friends and family that can lift you up, eating a healthy diet. Those are my 2 rescue dogs, you can see. Eating a colorful diet. When you eat food, always look down and see color on your plate. The 6 lifestyle pillars that we talked about: nutrition, positive social connections, reducing risky substances, sleep, reducing stress, and moving your body. Strength training is really important. Remember, it's never too early or never too late to make changes in your life, but be patient with yourself. Talk to yourself like you would talk to the most loved person in your life, okay? Women are very harsh. They say, my body is terrible, I look ugly, my body is failing me. Do not talk to yourself like that. So always talk to yourself with love and kindness and be patient with yourself. And when you look down on your plate and see color. That's the simplest way of getting lots of fiber in your diet. This is just some of the foods I tend to eat. In fact, this is the sort of food I ate in the last 24 hours in my friend's house. And the other important thing is that this is a diet that fits everybody. It's a diet that prevents so many health conditions. You don't need to count calories, but it also addresses some of the biggest changes. You know, we talk about being kind people, and if any of you know what happens in a dairy industry, what happens in a factory, you will really find that it is so hard to see baby cows being taken away, you know, all these animals being crowded together. Any of you who has a dog knows how much these animals are sentient, they feel pain, they understand things. So really, we all have a role to play in in our life, and it is important that we try and do our own role. But I come from the health aspect of things. So when you're trying, there's no different diet to help your health and help the planet. And so, as I explained, perimenopause starts 2 to 8 years before the final period. Menopause is 1 year of no periods. Hot flushes is the commonest symptom, and HRT is safe and effective for most. And you don't want to eat a standard American diet, you want to try and eat a whole food plant based diet or a plant predominant diet. And soya is safe, and strength training is very important. So it's really, that's the note I want to leave you with: educating, energizing, and empowering. These are all various organizations where you can read more about menopause, as well as the American College of Lifestyle Medicine and plant-based